Hi everyone, this is Aurelie Najm from Glasgow, live from San Diego Conference Center. I have a very cool abstract to share with you. It's abstract 1582. I think this is potentially the study that is exonerating TNF inhibitors in RA-ILD. Well, let's talk about this together. So this study was looking at the veterans database. They used patients that had roughly 7 years of RA and 3 years of interstitial lung disease. And they looked at data when they started their first biologic, and they compared what were the outcomes for those that received TNF inhibitors as opposed to any other biologic or JAK inhibitor. And so they matched these over 250 patients of roughly that number on many different features, obviously smoking and a lot of other things. And they looked at what was the outcome in terms of lung, and their primary outcome in their propensity analysis was death or hospitalization at 3 years. I mean, within the 3 years follow-up. And so what was really interesting in that study is that the adjusted hazard ratio was 1.2, and it was not significant. But I also look at specific other outcomes, death alone or hospitalization for respiratory disease, and again, the odd ratio was close to 1. There was no significance statistically there. They also looked at this outcome at 1 year, and again, no difference. And so what they did was that they did a sensitivity analysis in subgroups, and they looked at many different subgroups. I'm not going to detail here. I invite you to look at the abstract. But again, whether it's above 65, whether it's, biologic experience, those who would have maybe 2 or 3 other mechanisms of action, there was no difference there. And so I think it's quite good to know that maybe it doesn't make things worse. On the other hand, it doesn't tell us that TNF inhibitors improve lung disease in RA-ILD whatsoever. And I think we need to be really careful as per what is the question we're asking. If the question is, should we avoid TNF inhibitors in those people that have RA-ILD, or if they develop RA-ILD over the course of their disease while they're on TNF, should we stop it? I guess the answer is no. If we don't have any reason to. However, if someone does have RA-ILD, should we start them on a TNF inhibitor? I think the answer is no. And so this was used for the tentative recommendation that ACR did for interstitial lung disease. And so what they say is that everything is kind of provisional or conditional because there's not that much evidence. But what they say is you should not use TNF as a first-line treatment in someone that has RA-ILD, which I think it's pretty consistent with that. So I think it was really interesting study, and I wanted to share it with you. I invite you to follow me on Twitter at Aurelie Najm and tune on rumnut.com for more content. See you later.